Narcolepsy treatment is going to vary widely from patient to patient, depending on what symptoms the patient experiences, whether they have cataplexy or don't have cataplexy, or if they have other parts of the narcolepsy triad, such as sleep paralysis or hypnagogic, hypnopompic hallucinations. Generally, the first-line treatment for narcolepsy is a sort of stimulant to keep them awake during the day. Amphetamine, known as Adderall or Dexedrine, either of those are common treatments. We can use forms of methylphenidate, which is commonly known as Ritalin. A newer treatment on the market is a medication called Provigil, which is an atypical stimulant that targets the parts of the hypothalamus that regulate sleep and wake, and in most patients don't have the sort of stimulating effect or the feeling of a high that an amphetamine or methylphenidate would. And just as you need to treat the sleepiness during the day for a narcoleptic, generally narcoleptics have poor quality nighttime sleep and require some sort of sedative treatment, something like Ambien or Restoril. Any number of sedatives could be used to aid a narcoleptic in nighttime sleep if they have problems sleeping at night. Cataplexy and the other parts of the narcolepsy tetrad are caused by intrusions of REM into inappropriate parts of the sleep-wake cycle. Sleep paralysis is an example of this, where a person is completely fully wide awake, but they have no muscle tone and therefore can't speak, can't move, have no control over themselves or their environment. The cataplexy, which I mentioned, where a strong emotion causes a person to lose muscle tone and appear to faint or have a seizure, that's an intrusion of REM. The hallucinations that come with narcolepsy, that come at either the beginning of sleep or the end of sleep, again, are appropriate intrusions of REM. And it's found that antidepressant medications such as Prozac, Effexor, Zoloft, these medications, selective serotonin reuptake inhibitors, have a REM suppressant quality, as do tricyclic antidepressants. Elavil is the first one that comes to mind. There are a number that can be used. It depends on the patient. Sometimes it's a lengthy process to find the right combinations of medication for a narcoleptic. One of the newest medications on the market to treat cataplexy is a medication called Xyrem. It's available only from its manufacturer. It's been made under the Orphan Drug Act, and it's so tightly controlled because it is the pharmaceutical version of the street drug GHB, which has been used successfully in date rapes and has been used recreationally for a number of years. Xyrem in a narcoleptic is found to suppress cataplexy and to aid greatly in nighttime sleep, and it's been quite a boon for a number of the patients with whom I worked.